Hey everybody, today's topic is Hirschsprung disease. In the bowel wall we have mucosa, submucosa, muscularis propria, serosa or adventitia. In mucosa we have epithelium, lamina propria, muscularis mucosa. In submucosa we have micinus or submucosal plexus. In muscularis propria we have circular muscle and longitudinal muscle. In between them we have oid back or myenteric plexus, serosa, adventitia. So why ganglion cells within the micinus plexus and oid back plexus or absent? So definition of Hirschsprung disease: absence of ganglion cells in the oid backs and micinus plexus in the affected bowel. So why it happens? Due to arrest of the usual craniocaudal migration of the primitive neuroblast. Before going to imaging findings of Hirschsprung disease, we should know some definitions. What is transition zone? This is the perceptible change in the caliber with a dilated normal colon above and narrowed aganglionic colon below. So mostly the Hirschsprung disease rectosigmoid region is affected. Here this is the transition zone. Here you can see perceptible change between the normal dilated colon and abnormal narrowed part, that is the absence of ganglion cells, that is aganglionic colon. This is the transition sigmoid ratio. The rectum is normally wider than the sigmoid colon. The ratio of diameter of the rectum to that of sigmoid colon normally is more than 1. If the rectum is more, rectosigmoid ratio will be more than 1. In Hirschsprung disease, mostly the rectosigmoid region is involved. The rectum will be narrower than the sigmoid. So rectosigmoid ratio will be less than 1. Normally, most of the cases present in the neonatal period. Neonatal period is first 28 days. How they present? After birth, there will be delayed passage of meconium, abdominal distension, vomiting. In older kids, it may present like constipation. So on conventional radiograph, there will be changes of distal bowel obstruction. So then we go into contrast enema examination. Normally lateral radiographs are taken. What are the findings on lateral radiogram? Abnormally small rectal vault, abnormal rectosigmoid ratio, ordinarily rectum no ganglion cells, so it will be narrowed. Abnormally small rectal vault, rectosigmoid ratio, normally in these people the rectum will be narrow, so rectosigmoid ratio will be less than 1. And the transition zone, the above rectosigmoid, if the rectum is involved, there will be a transition zone between the rectum and sigmoid. The sigmoid part will be dilated. There will be crinkled appearance of the distal colon and there will be a corrugated rectum. Thank you. In Hirschsprung disease, what happens in neonatal period? If you delay the diagnosis, there will be bowel dilatation, bowel perforation, and chance of enterocolitis will be there. So its mortality will be more. And also what they tell the theory is, normally these kids in utero they are associated with malrotation. Due to malrotation there will be volvulus leading to decreased blood supply and intestinal atresia. So they tell intestinal atresia, and this may be one of the cause for delayed craniocaudal migration of the neuroganglionic cells. And this Hirschsprung disease may be associated with different syndromes and also Down syndrome, trisomy 21. In these people, normally all cases surgery will be done. Thank you.